with an associated trickle-down impact of 40% on commodities, basic goods and services, and an exchange rate of 470 to the dollar. Even though this may look higher than the federal government, but it is still not realistic relative to what the open market is saying. The 2023 budget is also designed to deliver a target of 5% GDP growth relative to the 3.75% growth targeted by the federal government, because we believe that the Edo State economy is growing at a faster rate than the national average. This will stimulate employment opportunities for our teeming youths and foster economic well-being for our citizens. Mr. Speaker, I believe it is necessary to outline some of our achievements in the year 2022. In 2022, we made considerable progress in the march towards sustainable growth, despite all the challenges, by prioritizing key areas of development and building on the gains made in the last 5-6 years. Despite the excruciating economic realities, we remained on course with our plans, maintained momentum in delivering our projections which we made for the year. Workforce enhancement. In the outgoing year, we consolidated on the ongoing public service transformation exercises by ensuring a seamless transition into digitization of our systems and processes in government, as I outlined earlier. In this year, 2022, we increased and implemented a new minimum wage of 40,000 naira, which is the highest in the country. This move was done in acknowledgement of the dire economic straits that workers have been subjected to as a result of galloping inflation and other economic hurdles witnessed in the year. Following this, we concluded a service-wide digitization exercise with the deployment of over 4,000 computers and other digital infrastructure, which have helped in creating digital versions of government records. We also rolled out phase 2 of the recruitment exercise, which injected new life into the civil service across various cadres. We've improved the infrastructure in which our public and civil servants work, just like we have in the legislature. Block B of the Secretariat Complex was completed this year, and various ministries have moved into the facility, utilizing improved work environments in delivering quality service to Edo people. The construction has advanced in the new Agric Hub, which will host MDAs in the agriculture ecosystem at the ADP property on Airport Road, and the Health Hub is being constructed to host all MDAs in the health ecosystem by Stella Obasanjo Hospital in Sapele Road. Human capacity development. We have sustained investments in human capacity development as it remains the fulcrum for our development goals, because we believe that our greatest assets are our people. Therefore, we have decided to strengthen our educational and health institutions to enable our people realize their full potential and get employment. The next phase of the Edo State Basic Education Sector Transformation, Edo Best 2.0 program, was rolled out this year, ensuring the disarticulation of the secondary school system from the junior secondary school system. We have commenced the process, and to date, we have disarticulated over 300 GSS schools from SSS. We have now trained over 15,000 teachers who are deploying digital tablets to teach over 300,000 pupils and students across public schools in Edo State. Technical education is also a priority for us. The Government Science and Technical College, GSTC Benin, has been a successful pilot for our statewide plan to strengthen technical and vocational training, TVET. We are working with partners such as the German government and the World Bank to roll out more TVET schools across the 18 local governments in Edo State. The Edo State Polytechnical Center continues to receive the required attention as we're ensuring that all courses in that school are accredited. Reforms in our colleges and universities are yielding positive fruits. The Edo State University of Owerri remains a shining light of our reforms, while the Ambrose Ali University is being restructured for sustainability. The Edo State College of Agriculture, with campuses in Igweraki, Agenabode, and Uromi, is taking shape as its reconstructed main campus in Igweraki will open for classes in the first half of 2023. Across the major elements of a tertiary education ecosystem, infrastructure, personnel, and operations are being emphasized as we retool the systems to deliver greater value for our people. Healthcare. The healthcare system in the state is witnessing a total overhaul as we have introduced changes that ensure that the people are better served, guaranteeing that healthcare is reliable, affordable, and accessible. For us, the focus remains on developing a vibrant primary healthcare system such that to that extent, we have transferred staff from the Ministry of Health to the Edo State Primary Healthcare Development Agency, while over 50 primary healthcare centers have been revamped, fitted with technology, and powered with solar energy to ensure minimal downtime. Leveraging strategic partnerships with the Association of Nigerian Physicians in the Americas, AMPA, we organized one of the largest medical outreaches in the States, providing our people with essential medical interventions that reached over 5,000 persons who ordinarily would not have been able to receive that quality of care. We have ensured a sustainable pathway by developing telemedicine facilities in some of the PHCs to enable the ANAP members in the diaspora to continue to provide consultancy to our people from the Americas. The Edo State School of Nursing Sciences today is a success story. It is oversubscribed, and we are expanding its accommodation to take in more students. The success of the school is a validation of our resolve to ensure that if our institutions of higher learning are restructured to global standards, they will attain self-reliance and run in a sustainable manner. The Edo State Health Insurance Scheme has continued to enroll more persons across sectors of the economy so as to shore up the numbers of persons making out-of-pocket payments for healthcare services. We have made room for enrollees from the informal sector so that we can have a much more robust scheme that not relies only on government employees across the entire state, so that it can respond to the needs of our citizens.